Hello everyone, welcome to Dentistionary. We are Human Physiology lectures, and today we are going to start our new topic, that is CV, cardiovascular system. Question box. You can put your doubts in the comment box. We will definitely try to answer those queries for you. Our first lecture on CVs, that is the physiological anatomy of heart. Heart, that every one of us knows, comprises of four different chambers. They are the two atria and two ventricles. Next, here you can see the diagram showing the four chambers of heart. The two atria comprises of the right atrium and the left atrium, whereas the ventricle comprises of the right ventricle and left ventricle. Right atria collects the blood poor or collects the oxygen poor blood from the body and then drains the blood into the right ventricle. Right ventricle then pumps those blood into the lungs. The lungs then refill the blood with oxygen. Whereas, what are the function of these two parts? The left atrium receives the oxygenated blood. Please mention the difference. The oxygenated blood, whereas here we have the oxygen poor blood, or we can say the deoxygenated blood. Right? So it receives the oxygenated blood from the lungs and pumps it to the left ventricle. From here it is being carried to this part. Then what the left ventricle do? It pushes the oxygenated blood into your aorta, from which the blood is pumped to the entire body. Mean what? The blood is being inserted from this part. It has been carried to the lungs. The lungs fill this whatever this blood with oxygen. It is being carried through this part, enters into the left atrium, then into the left ventricle, and finally through aorta to the entire body. Right? Is this clear? Next comes the valves of the heart. First of all, what are valves? Valves are actually the flaps that act as one-way inlet for blood getting into the ventricle and one-way outlet for blood leaving the ventricle. Correct? These valves prevent the backflow of the blood. So what are the types of valves we have? We have the AV valve, the atrioventricular valve, and the other different types that we are going to discuss in our next slides. Firstly, what are AV valves? The atria and ventricles are connected by a fibrous AV ring on right side by the tricuspid valve and on the left side by the mitral valve. Please note, mitral valve is also known as bicuspid valve. These AV valves prevent the backward flow of blood from the ventricles to the aorta. Just like already discussed in the previous slide, if this is your heart, these are the parts. Prevent the backflow of the blood from the ventricles to the aorta. From atria it enters into the ventricle. From ventricles it moves through aorta to different parts of the body, as already been discussed. So it prevents the backflow of the blood from ventricles again to the atria. Is it clear? Next, it closes and opens passively with the pressure different forces. Right? Is this clear? Moving on to our next valve, that is the semilunar valve, one of the most important valves. This consists of three flaps. Please note. Three flaps or cusps of a half moon shaped appearance, and they are of two types, the pulmonary valve and the aortic valve. Same as the previous one, they also open and close with passive different forces, right? Here is a diagram for you. Please see it. If you guys have any doubt, please ask me in the comment box. Next comes the heart sound. Here I have given a brief discussion on heart sounds, that is, I have mentioned only the first and second heart sound. In our next video, we'll discuss about the cardiac cycle, where I will discuss in details regarding our heart sounds. So the opening of valves is a slowly developing process and does not produce any noise, while closure of valves is a sudden process causing surrounding fluid to vibrate, producing noise. Hope so this sentence is clear for you guys. Like, if you open something, it does not produce any sound, but while closing means if the valves get closed, it is a sudden process. That is why it produces a vibration which causes noise. So the first heart sound is caused due to the closure of AV valve, very important. And the second one is caused due to the closure of semilunar valves. Clear? Next we have difference between the first heart sound and the second heart sound. So, as I already said, the first heart sound is produced due to the closure of AV valve, whereas the second heart sound is produced due to the closure of semilunar valve. This is the most important difference between these two. Next, it occurs at the beginning of systole, whereas it occurs at the end of systole, right? The frequency is 50 to 60 hertz, whereas its frequency is 80 to 90. See the time gap, it's 0.15 second, whereas that of second one is 0.12 second. Clear? The next topic is the pacemakers of heart. So what are the four pacemakers we know? The four pacemakers are the SA node, AV node, bundle of His, and Purkinje fibers, right? These are obviously some basic ideas that you all will be knowing or you all have already studied in your school days, right? So here I've wrapped them in short, mentioning their locations. Here are their locations. SA node is located on the posterior aspect of the heart at the junction of the superior vena cava with the right atrium. AV node is located posteriorly on the right side of interatrial septum. Interatrial septum means the septum between the two atria. Clear? Which is present near the opening of the coronary sinus. Next comes the bundle of His. The AV bundle originates from the AV node. At the superior and the anterior part of the membranous interventricular septum, the bundle divides into right and left branch. And lastly, we have the Purkinje fibers. What are they? Purkinje fibers originates from the terminal divisions of right and left branches of the bundle of His. Means the Purkinje fibers itself develops from bundle of His. It helps to penetrate the ventricular wall. Hope so these are clear to you guys. Yeah. So there's the end of this lecture. In our next lecture, I've already said, we'll discuss or we'll continue with CVS and we'll start with cardiac cycle. And also we will mention you the ECG, that is the electrocardiogram. Thank you so much. Keep sharing and supporting our channel, Dentistionary. Thank you.